cardiac surgeon warns, this common drug weakens the hearts of older adults. As a cardiac surgeon with decades of experience, I have seen thousands of elderly patients walk into my office worried about chest discomfort, shortness of breath, or a sudden onset of fatigue. And more often than not, the cause isn't just their diet or stress levels. It's the medication they have been taking for years. Sometimes, a drug prescribed to help with another condition entirely. What many seniors don't know is that some common drugs, taken daily by millions of people over 60, can silently damage the heart muscle, raise blood pressure, or trigger an irregular heartbeat. These drugs don't always show immediate side effects, but over time, they can weaken the heart and shorten your lifespan. In today's video, I will reveal the 7 most dangerous drugs that could be harming your heart health without you even realizing it. This is not meant to cause fear. It is meant to raise awareness. If you or a loved one is over 60 and taking medication for pain, sleep, blood sugar, or mood, you need to watch this video to the end. The first drug is the most harmful and the most commonly used. I am not telling you to stop any medication without medical guidance, but you deserve to know the truth. So let's begin with drug number 7. Drug number 7. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, commonly called NSAIDs, include medications like ibuprofen and naproxen. They are used for arthritis, joint pain, or back pain, common issues among older adults. Many people over 60 use them daily without realizing how dangerous they can be for the heart. NSAIDs raise blood pressure and cause fluid retention, which puts extra strain on the heart. For someone with an already weakened or aging heart, this added pressure can be enough to trigger heart failure or an arrhythmia. Over time, NSAIDs can also damage blood vessels and reduce kidney function, placing even more stress on the cardiovascular system. If you already have high blood pressure or are on heart medication, these drugs can silently work against your treatment. You may not feel the effects immediately, but your heart is under constant strain. This is why I always tell my older patients to be very cautious with over-the-counter painkillers. There are safer pain relief options that do not increase cardiac risk. Always talk to your doctor before taking NSAIDs continuously for more than a few days. Pain relief should not come at the cost of your heart health. Now, let's move on to drug number 6, which becomes much more dangerous over time. Drug number 6. Certain diabetes drugs, thiazolidinedione class. If you are managing type 2 diabetes, there is a class of drugs called thiazolidinediones, which includes medications like pioglitazone. They are designed to lower blood sugar, but they can silently harm your heart. These drugs can cause fluid accumulation and swelling in the legs, and in older adults over 60, they can lead to congestive heart failure. The goal is to manage blood sugar, but the hidden risk to the cardiovascular system is significant. Many older adults with diabetes are already in a high-risk group for heart disease. When you add a drug that causes the body to retain extra fluid, putting more pressure on the heart, it's a dangerous combination. Even more concerning is that these drugs can mask the early symptoms of heart failure, such as fatigue or shortness of breath. Some doctors may still prescribe them because they are effective for blood sugar control. But if you have a history of heart disease or even mild swelling, this medication could be quietly accelerating the damage. Always ask your doctor if there are safer alternatives. Your blood sugar is important, but not at the expense of weakening your heart. Now let's move on to drug number 5. Which millions of seniors still take every night to get to sleep. Drug number 5. Sleeping pills, sedative hypnotic class. Many older adults struggle with sleep and turn to sedative hypnotics, such as zolpidem or older drugs like diazepam. These medications promise better sleep, but often come with serious consequences for the heart. Sedatives slow down your entire nervous system, including your heart rate and blood pressure. While this might sound helpful, it actually dulls your body's ability to respond to stress or the need for oxygen during sleep. Over time, these drugs can cause or worsen sleep apnea, a condition where you stop breathing for short periods during the night. This puts extreme stress on the heart and can lead to dangerous heart rhythm disturbances. Furthermore, these drugs can interact with essential heart medications like beta blockers, making them less effective. The risk of falls, confusion, and breathing problems increases significantly with age, especially for those on other medications. While lack of sleep needs to be addressed, long-term reliance on sedatives can slowly harm both the brain and the heart. There are natural and safer ways to improve sleep without this damage. Consult a medical professional before continuing to take sleeping pills regularly. Now let's move on to drug number 4, a common mood stabilizer that could be slowly harming your heart without you knowing it. Drug 4, tricyclic antidepressants. Tricyclic antidepressants are an older class of drugs prescribed for depression, anxiety, or chronic pain. Medications like amitriptyline or nortriptyline were once common, but they carry heart risks, especially for those over 60. These drugs can cause a range of cardiac problems, including arrhythmias, changes in blood pressure, and even a dangerous condition called heart block. Over time, they can interfere with the electrical signals that control your heartbeat. This makes them particularly risky for seniors who may already have an irregular heartbeat or a slow heart rate. These drugs also increase the risk of dizziness and falls, leading to injuries and further complications. Even at low doses, long-term use without monitoring can be harmful. There are newer generations of antidepressants that are much safer for the hearts and brains of older adults. Unfortunately, some doctors still prescribe these older drugs out of habit or due to cost. If you are taking a tricyclic antidepressant and feel tired, dizzy, or notice heart palpitations, do not ignore it. Always ask your doctor if there is a safer alternative. Next up is drug number 3. This is one that millions of seniors take daily for a very common problem, but it has a hidden danger. Drug number 3. Decongestants, pseudoephedrine and phenylephrine. Decongestants like pseudoephedrine and phenylephrine are found in many cold and allergy medicines. Seniors often use them to relieve a stuffy nose or sinus pressure, especially during seasonal changes. However, these drugs can be very dangerous for the heart. They work by constricting blood vessels to reduce swelling in your nasal passages. But they also constrict blood vessels throughout your body, including the ones that supply blood to your heart. This raises blood pressure and forces the heart to work harder. In older adults, this extra strain can be dangerous, especially if you already have high blood pressure or heart disease. These drugs can also trigger arrhythmias or heart palpitations. You may feel jittery, anxious, or even dizzy after taking them. That is a sign from your heart that something is wrong. Many people assume these drugs are safe because they are sold over the counter. But age changes how your body responds, and what felt harmless in your 40s can now be a major cardiac risk. Always read labels carefully and talk to your doctor before using a decongestant. Now let's move on to drug number 2, a medication seniors often take for long-term acid reflux, unaware of its quiet impact on the heart. Drug number 2, proton pump inhibitors, PPIs. Proton pump inhibitors, commonly known as PPIs, are drugs like omeprazole and pantoprazole. Used to treat acid reflux and heartburn, millions of seniors rely on them daily, believing they are completely safe. However, recent studies have shown that long-term use can increase the risk of heart problems. PPIs reduce stomach acid, which helps with reflux, but that same acid is also essential for absorbing key nutrients like magnesium. Low magnesium levels can lead to arrhythmias, fatigue, and even muscle weakness. Over time, PPIs can also disrupt the gut microbiome and contribute to inflammation, which is directly linked to heart disease. If you have been taking PPIs for more than a few weeks, especially if you are over 60, it's time for a re-evaluation. These drugs should only be used for short-term relief unless absolutely necessary. If you are experiencing persistent heartburn, work with your doctor to find the root cause rather than just masking it. Your long-term heart health should always be the priority. Now it's time to reveal drug number 1, the most dangerous and commonly used drug that is silently weakening the hearts of seniors worldwide. Drug number 1, calcium channel blockers. Calcium channel blockers are medications frequently prescribed for high blood pressure, chest pain, or arrhythmias. However, certain types, particularly older ones like verapamil or diltiazem, can be risky for seniors. While these drugs are effective at relaxing blood vessels, they can also slow the heart down too much. In older adults, whose heart function may already be diminished, this can lead to dangerously low heart rates, dizziness, and even fainting. Over time, they can cause leg swelling, shortness of breath, and changes in heart rhythm. Some calcium channel blockers can also interact with other medications that seniors often take, increasing the risk of complications. The biggest problem is that many seniors are prescribed these drugs without regular monitoring, and side effects can be blamed on age rather than the drug itself. If you experience fatigue, swelling, or a slow pulse while on these drugs, it could be a warning sign. Never stop a heart medication without your doctor's supervision, but always ask if there are newer, safer options for your condition. This drug is powerful, but it requires close supervision. Final thoughts now. Let's bring everything we've learned today together with a final thought. If you are over 60 and taking one of the drugs we discussed today, I am not advising you to stop on your own. However, I strongly urge you to have a conversation with your doctor. These medications were designed to help, but when taken long-term or without proper monitoring, they can slowly inflict damage on your heart. As a cardiac surgeon, I have seen too many seniors admitted to the hospital not because of a health condition, but because of the side effects of their medication. The goal is not fear but prevention. With the right awareness and support, you can protect your heart, live longer, and feel better. Now is the time to take charge of your health. Be informed, be vigilant, and don't be afraid to ask questions about the medications you take. Your heart is too important to ignore. If this video was helpful, please share it with your loved ones and subscribe for more life-saving advice for seniors like you. Stay healthy and keep your heart strong.